everyone, this is Dr. Piontek here. I just figured I would try to do something different in terms of how I will be responding in this week's discussion board. I read through all of the posts in the response post, and I thought it might be a good idea just to provide somewhat of a summation of everyone's initial post, the question that they had responded to, and some key points that I basically read through everyone's threads. So as everyone's aware, you were given 3 possible options for this discussion board. And I'd like to start off with option number 1. There were 3 students who chose to respond to this question. I'll start off with Maria. You did a great job delineating a smoker's contemplation of quitting their habit to smoking and in terms of the trans-theoretical model of change. She also identified a population of people who would fall into this model. These are the young open heart patients. She included an article identifying sleep habits among those contemplating change and those in the maintenance stage of change. And as Maria pointed out, that essentially those with good sleep habits will often have a greater likelihood of maintaining healthy behaviors. So I think that just kind of goes to show, it streamlines along with maintenance of health behaviors and our sleep habits. So those that are in that maintenance phase will probably also have improved sleep habits. Tiffany did a great job identifying the application of the trans-theoretical model for CHF patients. As she identified, when nurses are aware of patients' readiness to change their lifestyle behaviors to manage their CHF, nurses can tailor their education specific to the patient's stage of change. This is a prime example of that patient-centered care. So when we can identify the likelihood or that stage of where the patients are on that TTM model, we tailor that level to what we need to provide education-wise to that patient. And Carrie made an excellent point that many patients have multiple poor health behaviors that are in need of change. And addressing all of these health behaviors at once could be overwhelming to the patient, which begs to ask the question, is it better to address the poor health behaviors all at once, or should we do it one at a time? And I think a lot will depend on the individual patient and their intrinsic motivation and self-efficacy to change their health behaviors. So when you are working with a patient who has multiple poor health behaviors, just kind of get the feel of, is this something that they're willing to do all at once, and then go with it. If it's something where they're very hesitant and they're like, oh, I'm just not sure I'm going to be able to do this, it might be better off just taking one health behavior at a time and modifying or getting them on that path to changing their poor health behavior. So moving on then to question 2, there were several students who chose to answer question 2. Anne, you had given a great example of the OSF St. Anthony's Hospital offering an updated website with resources, tools, and information to strengthen patients' health literacy in the community. One reference that you used highlighted the strategies to improve health literacy and specifically identifying 3 questions that patients should answer. These are open-ended questions. The first being, what is my main problem? Secondly, what do I need to do? And third, why is it important for me to do this? As Anne pointed out, when nurses and providers ask these questions of their patients, they have a better understanding of their patient's health literacy and what education needs to occur to improve the patient's health literacy. And Brooke, at her facility, Norton Health Specialists use an online tool called My Chart for patients to stay informed with their plan of care. This program allows patients to schedule appointments, send messages to their providers, and access their chart. As Brooke pointed out, this level of transparency and communication builds a trusting relationship between patients and providers. When patients are empowered and they trust their providers, they will have greater buy-in to take an active role in their health care. And Stacy, to improve patient engagement at her facility, they use social media outlets to inform patients of new programs offered by the hospital. One facet the hospital uses are virtual visits known as IntelliVisits. These provide an online diagnosis and plan of care. This form of telehealth is critical for those patients who may live in rural areas or who may have other issues with transportation. So I think this is a very cutting edge kind of medical platform that is being used. And I think we'll see more and more of these types of IntelliVisits or telehealth programs being implemented, particularly in our rural hospitals. And Jennifer provided several examples of what her hospital does to engage patients. One excellent point Jennifer brought to our attention was the ability to read among our patients. She had identified a reference which pointed out that the last grade completed in school is not a good indicator of reading ability. I found this to be a very important point because as nurses, we must be very careful to do a thorough assessment of our patients' ability to read and their reading level before we provide them with written discharge instructions. It's really pointless to give them reading material at the 8th grade level, for example, when they may only have the reading ability of someone in the 3rd grade level. And our two Megans, Megan French, I'll start with you. Megan identified a critical component in healthcare to inform patients. Patient education is instrumental to improve health outcomes. But how do we know our patients understand what we are teaching them? Megan did a great job addressing this through the Teach Back method. This method allows nurses and providers to assess their patients' understanding of the content. If patients cannot adequately explain what was just taught to them, then the nurses or providers must come up with an alternative educational strategy to educate their patients. And Megan Towell, you did a great job describing progressive medication education used at your facility. Based on the client's cognitive abilities, they can progress through the stages of understanding to the depth and breadth of their medication, such as reasons why they're taking the medication and any possible side effects. This program creates a sense of ownership among the clients and their adherence to their medication. So this is the first I've heard of this kind of program, and I think it is spot on when it comes to educating our patients and their medications they're taking. And Tara made a very important point in her post that was that there are several areas of improvement that can be made in the phases, particularly with informing, engaging, and empowering patients. These are 3 critical areas when it comes to improving patient outcomes. I think when it comes to patient education, we really need to focus on these areas and develop strategies to elevate their understanding of information, increase their level of engagement, and most of all, empower them to be their own health advocates. So great job, Tara, in identifying that. So moving on to question 3 then. There are several of you who chose to identify a health-related issue. And Kelly, you focused on improving physical activity. You made a great point that city planning is instrumental in developing and maintaining, for example, bike paths and sidewalks for pedestrians, connecting neighborhoods to grocery stores, schools, libraries, parks, etc. So it's one of those things that if they build it, people will use it. And I've seen this in several communities, particularly smaller communities, where they are starting to redevelop their infrastructure and allowing people to get around other than using their vehicles. Heather, you had identified implementing the Latchkey program, and I know you had posted this in a previous discussion board post, and I love this because this is a true example how important partnerships are in developing this. And I just wanted to give you an example. So I recently attended the Illinois Public Health Association convention a couple of weeks ago, and the president of Hillsborough Area Hospital described a initiative that was launched between the Hillsborough Hospital and Southern Illinois University School of Medicine Population Science and Policy Department. And so what they determined is that there wasn't really any avenue for early childhood or infant care. And so they developed a program, and they were looking at brain growth and brain development of children from infancy, very early infancy to 3 years. And they were able to put together a program that teaches parents how to interact with their children to improve brain development. And I just think that initiative just really speaks about the partnerships that can happen and the life changes that can occur. So implementing a latchkey program in your community is spot on. It really, you demonstrated within your post all the benefits that the latchkey program can do. And I think just teaming up with someone within your community to get this program up and running and sustainable is critical. And James, you had identified that providing education to junior high school kids surrounding why immunizations are important is, I just love this topic, because I think kids need to know why they're getting the immunizations. And we need to instill in them the culture of pro-immunization, in that if they understand the why and the impact that immunizations can have, they will grow up to be adults that will immunize their children. So I really commend you on that project. And Virginia, you had really touched on a very important topic as well, and that is the mental health and homeless population. You had identified that implementing a community center to address health needs of the population, such as providing immunizations, really addressing the needs of the community. I cannot agree with you more. I think probably the biggest obstacle that we have is funding. Having a location that's centrally located and getting those resources needed, it can be a big barrier to success of this. But I just wanted to throw out there that a community center doesn't necessarily have to be any one particular structure. It can be, a cross-utilization of perhaps a public school or a church, maybe their reception hall, or some area within the community. And it doesn't have to be stagnant. It can really kind of move throughout the community to get greater resources to those who really need it. But I was just thinking, one example of this is our VFW hall. We use it for all kinds of community outreach, and such as providing community immunizations, particularly for the elderly who may not be able to get to their provider's offices because of transportation issues. This particular spot is centrally located in the area where most of our seniors live. So that's just one idea that I had, that you can really tap into the resources that already exist in your community and meet those needs of the people within your community. So I just want to commend everyone on a great job with this discussion board. I would love to hear your feedback if you liked this way of doing my portion of the discussion board, or if you would rather that I go back in and have a more or less a typed written kind of response to your posts. So just send me an email, or you can put it in the discussion board for questions for instructor. I'd love to hear from you. So have a great week, and I'll talk to you soon. Thanks.